Hello, my name is Dr. Ricardo Barbuti. I'm an assistant professor of clinical gastroenterology at the University of São Paulo in São Paulo, Brazil. First of all, I'd like to thank you very much for the invitation. It's a great pleasure to have the opportunity to give a speech in such an important meeting. So I'm going to say some words about food, gut microbiota, and gut-brain axis, how to choose the best diet, and how this diet can interfere with our health. The search for the ideal diet is an old matter in gastroenterology specifically. There are different nutrition societies that recommend different types of food. The Brazilian Society of Nutrition recommends that we need to eat natural and minimally processed foods. And actually, the best example of health food would be the Mediterranean diet. It's a diet that includes vegetables and fruits, whole grains, plant-based protein foods, fatty fishes, and low-fat and fermented dairy products, and less amounts of lean red meats, and also even less amounts of high-fat dairy products and processed meats. These foods that we take can lead to reactions, and a bunch of different types of symptoms and signs can emerge when we eat different types of food. And these adverse food reactions can be immune-mediated or non-immune-mediated. The immune-mediated can be divided in food allergies and autoimmune diseases, and also the non-immune mediated are called food intolerance, and these food intolerance can be of different types. The most common intolerance are the carbohydrate intolerance that can be can have a genetic etiology or non-genetic etiology. The genetic etiology are really common, especially the adult type lactose intolerance that appears late in our development. The non-genetic etiology is composed by functional impairment in absorption, especially by monosaccharides, such as fructose and sorbitol, but also can occur in non-conforming functional impairments, such as the FODMAP diet, that stands for fermentable oligodimmonosaccharides and polyols. Diverse food reactions can also be divided in toxic and non-toxic, and this toxic can be the allergies and non-immune mediated, which are the intolerance. These food allergies can be IgE mediators or partially IgE mediators or non-IgE mediated. We also have some food reactions due to food additives such as sulfates, benzoates, and glutamate, which are added to some foods in order to increase their scent, their appearance, or taste, but also they can be present naturally in some foods. But other naturally occurring chemicals are really important with special participation with the vasoactive amines such as histamine. The great question is, why do foods lead to adverse reactions? And I can say that this is a complex answer that is based on different processes that I'm going to tell you guys right now. One of the main ways of changing the gut microbiota to lead to adverse food reactions is changing the gut microbiota. And the diet is really good in doing that, especially diets that are rich in prebiotics, which can modulate microbiota clearly. But also the diet can modify our gut and our microbiota for different ways that we're going to mention in the following slides. This modification of the diet changes our microbiota really quickly. Once you modify your diet in 48 hours, our microbiota is completely different. But the problem here is that this alteration, this modification of gut microbiota is unique. If you submit the same diet to different people, we're going to have different types of microbiota secondary to this same diet, which makes it difficult for us to guess what kind of modification we're going to have when you change diet and submit this new diet to different people. Not only prebiotics are really important in changing gut microbiota, but some food additives also modify these microorganisms like emulsifiers and sugar replacers such as saccharin, sucralose, aspartame, and everything. These types of additives are really able to change our microbiota, and this can lead to serious consequences in the gut and in the whole body. Once we modify our gut microbiota, we can reach a state that we call the dysbiosis, and this dysbiosis is defined by a group of microorganisms that are not the ideal group to keep our gut healthy or to keep our health in a way. So once we have a group of microbiota that's not the ideal, this is recognized by specific receptors located in the gut. These receptors are called pattern recognition receptors, which are the most common ones are the toll-like receptors. And once they notice that this microbiota is modified in a number of types, they transmit this information to our gut that responds in a non-ideal way, producing less mucus in yellow here, less IgA, less defensins, for example, and also they can modify the function of the tight junctions in our gut. This modification leads to an increase in gut permeability, making what we call the leaky gut. Once we are in this state, the leaky gut permits now that bacteria, their products such as LPS, even food antigens, now are able to pass the mucosa and reach the submucosa. And these antigens here attract immune cells such as the mast cells, which degranulate and attract other immune cells. And if you are in dysbiosis, these immune cells start to produce inflammatory cytokines, and actually the type of cytokines produced and the amount of cytokine produced and the type of cells that reach the submucosa, all these variables are modulated by the dendritic cells that are also present in our gut and have the same toll-like receptors as the pennant cells have that we mentioned in the previous slide. These dendritic cells have their function modulated by the gut microbiota, modifying the immune response in the gut, but also modifying the immune response in the whole body, so participating actively in the pathophysiology of different types of disease, such as the allergic disease, the autoimmune disease, and also these cytokines when can gain the circulation and reach the brain, modifying the gut-brain axis, and also participating in the pathophysiology of a bunch of different psychiatric diseases and also neurologic disease, such as depression, schizophrenia, autism, Parkinson's disease, and also even modifying our mood and, of course, our sleep. This inflammation that is formed in the submucosa is perceived by afferent vagal nerves and also by other types of fibers that take this information to our brain, that receives this information, modulates this information, filters this information, and sends a response to our gut, modifying the behavior of this gut in terms of motility, sensitivity, and gut secretions. These fibers that come from gut also arrive in the hypothalamus that communicates with pituitary, that changes the behavior of different glands, modifying our metabolism in a whole way, modifying our behavior in a very strict way. This microbiota modified by the diet can also interact with enterochromaffin or enteroendocrine cells present in the gut. These cells are able to produce more than 30 hormones, more than 95% of all serotonin that we have in our bodies produced by these enteroendocrine cells, and these cells have their production modulated by the gut microbiota. These hormones and neurotransmitters here can gain the circulation and act far away from the gut. And also they can modify locally the behavior of the gut in terms of motility and sensitivity. One of the substances produced by these enterochromaffin cells in our guts is the melatonin that can actively modify gut motility, interferes directly with immune function, and also interfere with gut microbiota. So the modification of the diet and the gut microbiota can also interfere in the peripherically melatonin, which is produced by immune cells and also by enterochromaffin cells. The modification of the gut-brain axis can also modify the production of melatonin in our brains, so interfering indirectly in the circadian rhythms. This gut microbiota can also produce a bunch of different biogenic amines, amino acids, short-chain fatty acids, and also gaseous substances that can, for example, distend our gut and lead to different types of complaints. But also these gases are able to modify our gut motility. For example, methane is able to decrease bowel habits. It's linked to functional constipation. H2S is linked to chronic diarrhea and so on. These biogenic amines and amino acids can gain the circulation and reach the brain and interfere directly in brain functions, modifying mood and all these things that we just mentioned to you guys. The diet can also modify our gut microbiota by what we call the horizontal gene transfer, which is the capacity that the phages that we receive with our food, this phage can modify our bacteria DNA and modifying our bacteria DNA. They modify also the interaction between this bacteria and our gut, and also can interfere in bacteria production of different substances. This is a way of adaptation of different types of diet, but can also be a way of modifying our microbiota and explaining why some complaints and symptoms can develop after some food ingestion. We can modify our body too through the diet, because we have more taste receptors in enteroendocrine cells than we have in our tongue, and these modify directly the gut-brain axis. We have more smell receptors in these cells than we have in our noses, and we also have what we call the transient receptor potential channels, or TRPs. There are channels that are capable of being stimulated by temperature of the food, pH of the food, osmolarity of the food, and this stimulation of these TRPs can also modify the gut-brain axis, as you see in this slide. The diet can also be linked to different types of symptoms based on what we call the hedonic mechanisms of the diet, which is the pleasure and displeasure that we have when we eat different types of food, and some certain types of foods can lead to dopamine secretion, opioid secretions, and even cannabinoid secretions in the brain, giving pleasure or displeasure when we eat different types of foods. We also can have adverse food reactions, immune-mediated, as we mentioned before, and different than we thought before. For example, food allergies not always are systemic allergies as we studied in our universities. And so when you had, for example, milk allergy, we consume milk, and when you have asthma, we have urticaria and all this stuff. But this not necessarily occurs when we talk about adverse food reactions. Actually can have an allergic reaction locally in the gut. There is an interaction between food antigens and mast cells in the gut, which lead these mast cells to secrete a bunch of different substances, for example, histamine, and histamine can change gut motility, gut secretion, gut sensitivity. We have some tests that have been developed to test different types of foods in terms of locally allergic reactions, such as collapse test, which consists in injecting a food protein in the gut mucosa and see what happens when the reaction is something like this. We can consider this food as a source of symptoms and take this food off our patients. We can also analyze this food reaction, this locally allergic reaction, but by what we call basophil activating test, which is basically a test that we isolate in our patients' basophils, and we expose these basophils to different foods and see if these basophils degranulate or not. If they granulate, we can associate this food with some types of reactions, and then we take this food off. Our microbiota can be modified also by our stomach acid production capacity, which is linked to our H. pylori status. And one of the things that happens, especially in regions where gastric cancer is more common, is that H. pylori is linked to atrophic gastritis, so decreasing the production of chloric acid, and this chloric acid now, when it's lacking, leads to the development of what we call the small intestinal bacterial overgrowth, increase the amount of bacteria in the small intestine. This augmented number of bacteria are able to ferment different types of carbohydrates even before they are digested, so increasing the chance of having food intolerances. Especially this is observed in lactose and even more commonly with fructose and sorbitol, which are monosaccharides that are observed really high in the small intestine. So the more bacteria we have, the more fermentation we're going to have and more intolerance we should have. These fermentation of prebiotics leads to the production of these short chain fatty acids such as butyrate, and these guys can modify gut pH, interfering with the microbiota, and then can also attach to specific receptors, the free fatty acid receptors type 2 and 3, which are present in the intestine, are present also in vagal nerve fibers, and they can modify gut function, they can modify our immune response since they interaction with the dendritic cells also. They can modify satiety and hunger, they can modify gut permeability, and they can be absorbed, reach the brain, interfere directly in the gut-brain barrier and the blood-brain barrier. The microbiota fermented in producing gases lead to distension of this gut, and this distension can activate mechanoreceptors that can modify our gut-brain axis directly. An example of how can food modify our gut and lead to different types of symptoms. Sometimes when you eat a food, it leads to symptoms, and sometimes it doesn't. It can be explained by these variables that I'm going to show you right now. Once you ingest lactose, you're going to have symptoms or not, depending on lactose dose. If you take lactose only or together with other types of foods, the lactase expression, the transit time, the small intestinal diseases that can interfere with lactase production, surgical anatomy, the type of bacteria presented. If you have saccharolytic bacteria in your gut, you ferment more lactose. If you have SIBO, you're going to ferment more. If you have a high visceral sensitivity, you're going to have more symptoms. Endocrine factors also interfere in these. Microinflammation, barrier function, and our mood status is always important in modulating the symptoms. So we can, usually going to have more symptoms and more intense symptoms when you are depressed or when we are anxious and so on. And all these things modulate the type and frequency of symptoms that we have when you consume different types of food. The microbiota can also interfere in the development of immune-modulated food disease, such as celiac disease. As you know, the formation of our gut microbiota starts even before our birth, but it's the type of delivery and also the type of food that we receive, if we're breastfed or not. This can interfere in the formation of our gut microbiota, which is actually more important the first 1,000 days of our existence. So if you take individuals with a history of cesarean delivery and without breastfeeding in the first years of life, they are more propensity of developing a celiac disease or wheat sensitivity or wheat allergy. The presence of intestinal infections during these first 1,000 days can also interfere with the formation of child's microbiome and immune tolerance, include food and microbiota antigens. And this search for a health diet can also interfere with the development of different types of psychiatric disease. There can be more and more diagnoses in our practice, such as the orthorexia nervosa and also the avoidant restrictive food intake disorder, which are really increasing everywhere. So we can conclude that the gut microbiota interferes directly in all gut functions. Gut-brain axis is modulated by the gut microbiota. Diet is able to modify our microbiota and consequently the gut-brain axis by many ways. We are just starting actually to understand what the mechanisms involved, but what we can say to you guys is that when we change a diet, we need to adapt this diet to our patient. The same way that when you go to a tailor, we can choose the material of our suit, we can choose the color of our suit, but this tailor is going to adapt the suit to our needs, and it is exactly what we need to do with our patients, especially when we're dealing with gastroenterological disease, such as IBS, and also specifically to food adverse reactions. Thank you very much for your attention. Thank you.